Hey, Kallie, how are you?
Whoa.
It's so good to see you again.
I know. It's been a long summer, so apologies to our listeners that we
I
haven't
know.
been regular with putting out episodes, but we're both enjoying summer and
Yes.
everything it brings. But we're so excited for today's episode.
Yeah,
It is something especially near and dear to Christina's heart. It's near and dear to mine, our company's, our overall mission. And so with that,
well, let me
today.
just say, welcome to the Unwrapped Podcast, everybody. We're so bad at this.
Okay, good.
um, I hear you have a fun fact for me, as always.
As always. Okay, so not directly related to wound care at all, but it is related to our conversation we're going to have today. So there are over 75,000 individuals experience homelessness in the Los Angeles County.
That's wild. But also not unbelievable because if you guys don't know, for listeners, I live in California. I'm around the LA area and even Orange County, everywhere. Homelessness is out of control, which I'm sure is in every city, right? Like especially with costs rising. It's like when you say that number out loud, it's crazy to me, but also like, yeah, that makes sense with what we're seeing.
Yeah, I mean, I guess it's especially like for you, it's like, okay, you can kind of maybe that number's a little bit more tangible for you. For our listeners, if you don't know, I'm in rural Utah. Okay. That number is 60 times higher than my town's population.
That's crazy.
60 times. And to me, it's like, I couldn't even fathom that, right? Of course, when I come to visit you, and obviously I visit cities. Like, I'm not just like out here in a little farming town by myself, never leave. And I used to live in Las Vegas, right? So like I hear that number and I'm like, okay. But then when I like drive down to my local post office because we don't have mailboxes because we're so rural, um, there's not even a fraction of that in this town, right? So day to day, what I see. So yeah, hearing that number, it blows my mind. And it really speaks to this conversation we're about to have with Hawkeye Brimbuela, who is part of our WCA team. Well, he'll introduce himself later, but yeah, Christina, give us a little glimpse of what we're going to be talking about today with Hawkeye.
Yeah, well, first off, bias, but Hawkeye is one of the most incredible humans that you'll ever meet. He comes off as this rugged guy and sometimes intimidating to talk to, but I've never met someone who has such a passion for this the field that he's in. He's been a nurse for a long time. We were fortunate enough to get him, gosh, I think almost a decade ago, where he was wanting to do more in wound care. He was brought on our UCLA team and has just thrived there. And obviously it was easy for him to grow within the company and be where he's at now, overseeing the Western region. And something that Hawkeye and I bonded over is our passion for wanting to help those in need. And when our client, UCLA, introduced us about the Homeless Healthcare Initiative, which for those of you who don't know, UCLA system started a almost like a street care type of clinic, van based, where they drive out. They started off with 2 vans. You'll hear more about that from Hawkeye. And now I think they have like 5 vans, but they go out to different parts of LA and provide care, not just wound care, all care. And that could be from like maintaining their mental health meds, or they're sick and need antibiotics, or they don't have a ways or a means of getting any type of PCP care, whatever. It is a holistic approach that they do, and wound care that they were seeing an increase up. And that's why they reached out to us, because we already have a wound center with them. And so they were like, hey, can you guys just help? Like, these clinicians just need more education. And so that's really where it started, of just teaching wound care to then being like, can we do a ride along, to then really seeing what they're doing in the street, to then being like, oh, hey, we can give you guys more resources. We can get vendors engaged. We can build you wound packets. We can build you education. We can support you in A, B, and C. And it just kind of grew from there. And that's why I really love this episode. I know you guys, we say we love every episode we do, but I love this episode because you guys are going to really hear from the start to where we're at now. We're nowhere near finished, but like where the program from our perspective has grown from a wound care view of what we've been able to do. And just if this encourages you or encourages or pings something in your heart that really resonates with you, like that's what we want out of this episode, to just kind of share where it's grown and where it's going to go.
Yeah, absolutely. And I love that you say that. And as always, you're right. This isn't just about the clinicians. This is for everybody that's kind of in that public service industry, whether you're, EMT, fireman, policeman, teacher, anyone that's dealing with the public. I think this episode is so valuable to all of us because there's a place for every single one of us to help and do more for this patient population. Because, whether you're the teacher and you can see those in your students, whether you're the policeman and you're just trying to make sure they're safe on the streets, the firemen that are also being called out, EMTs, right? So it's really just there's a place for all of us if you want to do more. And hopefully, after you listen to this episode, you'll have that little spark burning a little brighter, and you'll kind of want to help out. So if you don't know where to start, Christina has already mentioned this, and she'll mention it again. Reach out to us. We'll help you find a place.
Yeah, absolutely. So with that, we'll bring on the interview. Anyway, thanks so much for joining us today, Hawkeye. We're thrilled to have you here.
Thank you. I'm excited to be here as well.
For those of you who don't know Hawkeye, this is Hawkeye. And yes, that is his real name. Hawkeye, I've had the privilege of working with you for many, many years now, but will you share with the audience your position, your background, how long you've been working with us?
Sure. Been in the healthcare field for quite some time now. I started as a CNA, did that for a few years, LVN, and then for a few years at Harbor UCLA, worked for Kaiser since I became an RN. Majority of my time was in the telemetry, and in the last few years of my career, I was a charge nurse in med-surg telemetry and just doing different aspects and whatnot. I left Kaiser and I joined WCA in 2015, 14 maybe, 16, something like that. I don't know.
Coming up on 10 years.
Coming up on 10 years. And I started with WCA as a clinical nurse at our UCLA wound care center. After some time there, I became the clinical director there. Did that for about 2 years, and then I was fortunate enough to be asked to be a regional clinical coordinator, which I've been doing now for the past 5 years. Yeah, 5 years. So yeah, that's my job. I get to oversee a lot of our risk share centers on the West Coast, as well as a few other centers around this area, and been with WCA for a good time. For a good amount of time.
There's one thing you guys need to know about Hawkeye. He's a humble man. He runs our West Coast region. That is obviously because it's the closest to our corporate office. So these centers are more involved. This staff, he oversees not only operations with his operational counterpart, but the staffing. So a lot of day-to-day things. And yeah, we're just so thrilled to have you here. We are excited to talk about the Homeless Healthcare Initiative that you have helped start at UCLA. So for those who don't know, one of our clients is UCLA, and we've had a wound care center there for well over a decade. And we got involved with their Homeless Healthcare Initiative, I'd say like 3 years ago.
Yeah, it's been about 2 years since we've been talking about it for 3 years.
Yeah.
And then in the last 2 years, really have, implemented it, done the training, gotten people involved. So big kudos to you guys for actually getting it off the ground.
Yeah, it was something I think Hawk and I both really had a passion to help the people that have been experiencing homelessness. And just because we know with drug use and all of that, especially in San Francisco, like when we talk about all of our clients in different areas, that wounds were a big issue. And a lot of times, especially UCLA being UCLA, we do see a lot of this population in our clinic. And so when we found out that our client was actually sending a team out, like a dedicated team, day in and day out, clinicians, physicians volunteering their time to do this service, we were really interested in it. And so, they had asked us, and obviously kudos to you, Kallie, because you helped us build the education platform and everything that supports what Hawkeye and Brian does out on the field with the team. But the reason why we were so excited to talk about it is, you know, we've learned a lot these past 2 years, a lot of changes and adjustments, because it was very different, right, Hawk? I think like you and I talked about how we had to change how we thought about things, very different, and in the outcome and what we wanted to happen as well was very different because of you're doing street care essentially. But yeah, I just kind of wanted to pick your brain, Hawkeye, of like kind of everything that you've had to do and experience with the team and the things that you've taught them. Like, how's it going? What's kind of been the hardships? What's the things that you've learned? Tell us all the stuff.
All right. Well, I guess I'll start from the beginning. So when I first learned about the homeless healthcare team, or the HHC, I guess is what they refer to it as, is I was just super curious on like the why, right? That's always important. Like, why are we doing this? How did this even come to be? And I guess 2016 was the initial kind of rollout where they started to identify needs. Initially it was just about going out to the street, helping with like housing, helping with mental health and behavioral issues. And then it started to progress. I think that a lot of Medicare beneficiaries were out there. And then they started creating different programs. I think the first one was the whole person care program. And then it morphed into, or then it turned into like a housing thing. COVID kind of like accelerated all this and how we can do better. And it wasn't till 2022 is when UCLA was the first homeless healthcare collaboration launch. And that's when they were kind of state funded. And essentially they started off with 2 vans, and they were just going out and just trying to meet the need, right? Trying to provide, high quality healthcare, try to have like equity in the community and just kind of solve these problems. And when I was talking to some of the members of the team, they were saying, one thing they noticed too was that a lot of our ERs, specifically the UCLA ER, was inundated with just like a lot of individuals who were experiencing homelessness. They were going there for minor things, and it was impacting kind of the flow of the ER, right? How much of this stuff could we have, I think the question became, how much of this stuff can we address or help with outside of, the ER to kind of decompress the ER and allow for more emergent issues. And again, early 2022 is when UCLA created that program. They started off with 2 vans. And then it wasn't until 2023, they started having, they were seeing a lot more wound care patients. As you can imagine, given, the same types of disease processes, comorbidities, and issues that individuals have, this homeless population also experiences that as well, right? They're even more challenged because they don't have the resources. They don't have the ability to care for themselves in these kinds of ways. So, yeah, that's where that came up. And wound care was one of the big things. And I wasn't a part of the initial conversations as far as, actually, Laura reached out. Laura Yost, the executive director of UCLA, connected our wound care team, or connected us with them, and just said, hey, there was just initial conversations about like, hey, we do see a lot of, patients with wounds. We'd love a little more education. And bless the team. The team is amazing. They're made up of LVNs. They're made up of RNs, critical care nurses, ER nurses. So they do have that exposure, that experience of being out there, or interacting with this type of population. It's just they didn't have the skill set, or they didn't have the fine-tuned knowledge of wound care that you and I both offer, or that experiences that we have in the training that we have. So they linked up with us, and it wasn't until mid-October, I went on my first ride along with the team. Got a chance to hang out with the team and see what they see, and that was cool. We went on the first rig, the first ride along. It was me and our CEO, Mike Comer. We just kind of wanted to experience it and see what it was like and what it was about. They are fully equipped. They carry medications. They carry everything. And just going out with them was just really, really impressive, because you saw how impactful they are for the community. Everything from where they're planning to go, who they're planning to see, what they're planning to do, it's mapped out. And the team, again, is made up of RNs, LVNs, physicians, a social worker, and security, which, as you can imagine, in these types of environments, you do need that kind of security. But the role of the case manager was incredible to see, because or social worker, because you get to see how they interact and kind of how they bridge that gap with trying to get these individuals the care that they need, the resources and everything that they need. And then while they're squaring that away, we're doing our assessment, whether it doesn't have to necessarily be wounds. It could be, medications that they've been prescribed and they just need a refill, but if they find it challenging to get, maybe it's a matter of providing them a cell phone or clothing or food or anything like that. So it's a very holistic approach in that sense. And again, just emphasizing the fact that this is like quality healthcare that they're delivering. It isn't just like, here's a sack lunch and, some Tylenol. Like, they're doing full on head to toe assessments. They're doing just, everything that you would expect when a patient would go into the ER. We're bringing it out to the street. And then when Mr. Comer and I were actually in the rig, they were like, "Oh, we're going to go find all our wound care patients," which was fun. One thing that I will note is, because of that kind of, again, as I mentioned, that interaction with the case manager and all that stuff, a lot of these people experiencing homelessness, they all have cell phones, and they interact, or they communicate with the cell phone. So they've called a few patients while we're driving on the street and be like, "Hey, where are you? We have some wound care nurses. We'd love to help treat your wounds." And they would call them, and then they would say something to the effect of, "Hey, I'm on, Santa Monica and such street. I'll be right next to the Whole Foods in the back near the dumpster." So we would pull the rig up there, open up, break out, the tables and the chairs and the wound care supplies. And yeah, they would show up, and they're being a new person on the rig. There was kind of that feeling out, because obviously there's a trust factor going on there. And now, they see myself and Comer. So there was a bit of a 15-minute kind of like introduction period until they felt comfortable with us. And then just me getting to do what I normally do in a wound care center out on the street. Right now, to go back to what you were talking about, which was, adjusting the way we do wound care. Right. That was one of the things that I found very challenging and really fun about the whole thing. Your audience may or may not know, when they come into the wound care center, that's our environment. That's our world. We control, a lot of things in there. As you do when you're a nurse, you're able to kind of like optimize your environment so you can give the best quality care. In the street, behind a dumpster, next to a pile of trash, with cars zipping by, and just it's a completely different world. So adjusting and trying to effectively provide the same type of wound care in those environments was really challenging. The other thing that I found challenging too was understanding that these patients do not have the same resources. You can give them dressing supplies and you can educate them, but my one touch with them does not compare to, or won't even stand up to the fact that, hey, their biggest concern is, where am I going to sleep at night? Their biggest concern is like, okay, now I have this dressing, cool, it's protected. Now I got to worry about, hey, I don't want to get mugged. I need to move all my stuff here. Where will I find my next meal? All those kinds of things. So as a nurse, trying to incorporate that all on the fly was really challenging. As a matter of fact, the very first patient that we met, with the popsicles, the tongue blade story. So this gentleman came up, venous leg ulcer, oozing, and he just had, your typical untreated venous ulcer. It was wrapped in Curlex, and that was it. And we cut it down. Was able to, as I'm doing this stuff, I'm telling the nurses what I'm doing. I'm explaining to them the importance of wound care. Whether it's the wound hygiene, making sure that, the entire extremity is addressed, not just the wound, right? And then looking at the wound and kind of just trying to assess the base, trying to assess the amount of drainage, trying to do all that. And I noticed that there was drainage that had kind of caked over. It kind of solidified, and it almost was creating a pocket for fluid to accumulate. So I took a tongue blade, I broke it in such a way that it had a sharper edge, and I started to pick things off to allow that stuff to drain and to allow the fluid to escape, to expose the wound bed. I did not clean off the slough because that's not my job. That's not where I'm at. I just needed to get a better look at what it looked like underneath there. And then I did that. I finally exposed the majority of the wound bed. I mechanically cleaned it as best as I could. And, just again, while I'm doing that, I'm explaining to the physician, I'm explaining to the doctor the importance of wound care, why I did what I did, and how that's going to ultimately help at least keep the wound healed. And that's the other thing, the other part of the homeless healthcare team that we had to modify and then modify again, and I'll get to that in a second, is where we approach this even as a team, Christina and Kallie. I know we remember, like, all right, so because of the nature and where these patients live and their environment, is full wound closure something that we are aiming for? Or are we just simply trying to stabilize the wound as best we can, prevent infection, keep it clean, and, hope that it doesn't get infected and we just continue to monitor it, right? And that's the approach I took the very first time. Actually, the very first time we provided education with them, that was kind of like our point, right? Because if we know in wound care that you need good circulation, you need good nutrition, free from infection, and all those things combined together with, standard wound care and appropriate wound care, routine wound care, that's how we get wounds to heal. In this environment, you don't have it. You may or may not have that. So that was the initial kind of education or knowledge that we were sharing with them. Was just, let's just stabilize it. Let's get it clean. Let's keep it protected. And as best you can, see them routinely. And, that was kind of the best that we could do for this population. And so that's what I was sharing with the team. And then through education, through continued partnership with the team, through working with them, almost like every quarter, where we would go, I would continue to go on ride-alongs. We would have educational courses, in services, boot camps, whatever term you want to call it. They started to heal the wounds, man. And that was pretty impressive.
When Hawkeye called me, Kallie, he's like, Christina, you would never guess, because again, going back to, like, we had to change our mindset. My thought is, how are we going to heal these wounds? And Hawkeye's like, no, that's not the goal. I'm like, oh, okay. Because shout out to our vendors. We had really great vendors that partnered with us to help us build these, like, almost wound care packages, because it wasn't like all the stuff that we would need, right? Me and Hawk have all of these great tools in the clinic, and we're like, oh, we need to be real simplistic. But how do we pick the dressing that's most effective, that is easy for them not to have to take on and off, that can last a few days? Because honestly, they're not doing daily dressing changes. So we had to really think about that. And one thing that I learned when I was able to go out one time is this population does not like a lot of stuff. I'm thinking, oh, we're going to give them a bag full of dressings and da 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 da, and they're going to change it. They were like, I don't want that. They didn't even want, what did we try to give them, Hawk? I think we tried to give them like a business or something. They were like, I don't want that. And just like kind of going back to what Hawkeye said, they have to grab their stuff and go. And so it clicked for me, right? Like, oh yeah, they don't want extra stuff that they have to carry. So how can we make it super simple? And like we were coming up with like QR codes, like how could we give them the resources and knowledge because they all had cell phones. It was very different and very, yeah, like totally mindset change. But when Hawkeye called me and was like, you'll never guess the stories they told me, like they're healing patients. And I'm like, that is incredible. Like, because it wasn't even our goal, but because the team shout out to the team, they are incredible nurses.
100%.
The passion that they have for this population and like just doing, I don't know, they're just incredible people. The care and the attention that they're giving them is why they're healing, and it's amazing. It's so cool. And I think it wasn't our goal, but it ended up happening, and I was like, Hawkeye, we have to shout to the rooftops because I think that's so incredible that that's the outcome that's happening just by good wound care and adapting to what this population needs, instead of vice versa, making them fit into what we want them to be.
I think this is my fourth in-service or what we call boot camp, right? Every time they have new staff, whether it's physicians, whether it's PAs, NPs, or even nurses, they want this continued education. And typically when we show up, I'm always just expecting the new folks to be there because we've already gone through it with everyone. But no, they're so engaged. And I think that's what's super awesome about it is that the nurses there, they have a passion for doing what they're doing. They really want to be there. And I have to say, you have to want to be there to do it. You know what I mean? This isn't
hard.
This isn't like just something that, I just want to, like, as nurses, sometimes you just want to get a gig somewhere. You just want to do what you got to do, get in the door, quote unquote, and do, nursing. This is one of those where it's just like that extra higher level of nursing care that's being delivered completely outside of what any nurse fresh out of school was trained for, right? And being able to think on the fly, being able to make adjustments and having that, I think one of the things too is creating that nurse-patient relationship is huge, especially for this population. Being able to kind of interact with them and build that trust and build that rapport, so they will actually allow you to touch them. Now, we're talking about individuals who may have mental issues.
Mm-hmm.
We're talking about individuals who have definite trust issues with healthcare, authority, anything along those lines, So being able to tactfully to interact and deal with these patients these nurses are so impressive in that sense. And then when we go there to provide our boot camp, and when I talk about boot camp, because, we're WCA in the way we teach things from the ground up. We went over pathophysiology of wounds, right? The 5 phases of healing. We talked about the importance, the triangle of, peri-wound, wound bed, wound edges, skin. And then we even did a deep dive on products, right? And again, shout out to the vendors that were there to help us because they were there at some of the boot camps to also help educate and give the nurses knowledge and understanding of the dressings. Just through those interactions, they were able to take that and they took that really to heart and they were implementing it while they were out on the street team. And a part of our collaboration with them was, this, Christina, we're just readily available for them. I gave them my work email. I'm on the teams with them. I also gave them my work cell phone number, and I would just, be getting hit up all the time. Hey, what do I do about this? What do I do about that? So it wasn't just the education. It was just the constant collaboration that we had with them that I feel like really empowered them.
We were just talking about this because in the beginning it was and it was a new concept, right? And it was the team at that point when we were talking about wound care. They would message us all the time And when Hawk and I got together just a couple weeks ago, I was like, they don't message anymore. And he's like, yeah, me either. And it's kind of like, it is a true testament to you, Hawkeye and Kallie, the education that you helped us develop. They are taking it so fully and like digesting it and really wanting to learn it, that they are learning it and they don't need us anymore. And it's proud moment, but also like, oh, yeah,
Yeah,
they're not calling us anymore and asking the questions. But I also love that they're really learning. They're really um seeking to be able to like really understand all of this, and not just like, oh well, because they easily could have been like, I don't want to learn it fully, I got Hawkeye, I'll just keep calling Hawkeye.
yeah, yeah,
And so I find that that was super impressive as well.
yeah. One thing I noticed too is like you would go to do the initial education, or I remember doing the first round of education with the team. A lot of the questions were just, uh, we would have our educational portion, and then the last half of the class, we would open it to case studies, right? Hey, take pictures, whatever you find challenging, bring it to Christina and I, and let's dissect it. Let's break it down. And then they'll flash a picture on the screen and just be like, what do we do here? And Christina and I will take a look at the wound. Because they're so good at assessing and getting all the information, it was just like, so tell me the comorbidities. Is this patient on any type of medication? Are they abusing drugs at the time? What else can we know about this to help build a better clinical picture of the wound? I remember even asking, what's the situation? Like, is he a transient, or is she a transient where she's constantly moving from location to location? Is she kind of stationed at one of what they call camps, or, an area that a lot of these individuals just kind of hang out in? What's the situation? And so getting all that information and then trying to formulate a care plan. Okay, this is what we would do to the wound. This is what we would do next. This is how we would address it. This is the dressing. From that initial kind of education to my most recent education with the team, which was about a month and a half ago, they'll show us a picture and they'll be like, so this is what the wound looked like when we first started, and this is what it looks like now. And it's like, you're holy, it's healing. You guys are doing it. You know what I mean? And what's also impressive too is because in the beginning we were just like, listen, you need categories of wound products. You need something that's a super absorber. You need something that has antimicrobial properties. You need, and then some very simple dressings: Curlix, abdominal pad, 4x4s, something easy. Again, with the mindset of just stabilizing the wound. Now we've gotten to a point where they're like, hey, this is venous. Like, can we offer compression? Can we do this? What else can we do? Getting almost those more advanced treatment modalities that we would offer at a wound care center, right? They're asking about collagens now, and you and I both know collagen was never something we would be
No, we
like.
were like basic, like
Yeah, we were like, what?
antimicrobial, basic, super absorbers. Like that was it.
Nah. Velveteen
Yeah,
cream,
it was just, we were like
triple
simple.
maybe.
Yeah.
Yeah. And then, now they're like, they'd see ones and they'd be like, hey, it's kind of stalled. And I'm like, stalled? Wow, look at you guys stalling out wounds, And I think another thing that kind of led to that as well was when we did the debridement class with them. So they had physicians, they had PAs that were like, hey, tell us more about debriding. Tell us more. Because we're talking about like keeping the wound bed clear. We're talking about, wounds getting stuck in the inflammatory phase and the bioburden, how we can mitigate or kind of manage that for these types of patients. And then we said, the best standard is serial debridements, right? We talked about that. And then they were like, well, teach us that. Nurses thought they could do it, and they were stoked to want to learn how to do it, and they attended the class with us. But unfortunately, they can't do the debridements. But when we had that debridement class, we were lucky enough to have UCLA's Dr. Jessica O'Connell to come out.
Shout out. She's incredible.
She's amazing. She did the course with us. She, again, we've had multiple vendors who have been able to, help provide different options that where, again, due to the environment, like we want to introduce scalpels into the environment, into the street. So we've had some vendors provide some, alternatives to that. that aren't necessarily, surgical instruments or anything like that. So yeah, we've just been very fortunate to have great vendors, great collaboration with these teams or these companies to help us really create what I think is a pretty badass system. You know what I mean?
Yeah. Yeah. I think one thing I'll add is listen, I keep it real. So when we're talking about debridement tools and stuff, I mean, me and Hawk all day, we're like simple. We don't feel like we need all of these fancy other debridement things, because at the end of the day, the core of it is a scalpel, right? Like, and a curette. Like, our docs can do it all day long with that. But when we had to think about, okay, it's probably not the best idea for our docs out in the street in an environment we're not familiar with a 15 blade, we had to really think. And I think that was so cool about engaging with these vendors with different options. And I don't know about you, Hawk, but like, even, oh, that's an option. That's an interesting tool. Like, there's so many different debridement tools, which is really cool for this type of situation. And we got to experience them and have our physicians practice. So that was cool. But I will say, our nurses were all gung ho. And then we did more research, and we were like, right now the clinicians can't do it. But I'll tell you, they still all showed up to the class, which just is like, that's true teamwork. Like, they were like, no, we can't do it. Cool. But we want to know so we can support our physicians.
Yeah, 100%.
Like, that's what I'm talking about. That's the camaraderie that you need, because that way they can support one another. And they truly do. It's not like one against the other. They really, especially when you're out there, it can kind of be nervy, especially as a female. But you have security, and then you have each other. And I think that's such a core thing that you need when you're doing this type of care.
100%. Yeah. That course was really fun because we got to see everybody's eyes light up. And then I think it was after that course, it was maybe another 2 months or month and a half. Then we did the wound care course, again with newer team members. And yeah, that interaction, the case study portion of it went from, just like, what do I do? To like, this is where we're at. So what else can we do? You know what I mean? We've done everything that we talked about. We're following, we're even, modifying things that's best for the patient and all that. But how else can we, get these wounds to full closure? And it's just really impressive. Another thing too, that we've been able to kind of create or to help with was having that bridge, or being that, what's the fancy word for it? Being that conduit, right? They would have patients that you would look at the wound and just be like, you need more. We're giving, we can do what we can from here, but you need more. And then collaborating with our actual wound care center and connecting, the case managers to our front office at the UCLA Wound Care Center, or even Verdugo, based on the location that this patient is more, is more available towards. And we've been sending, I think, 2 or 3 patients now to the UCLA Wound Center. What they'll do is they'll find them. They'll be like, hey, you need more wound care. I can get you an Uber to go to the UCLA Wound Care Center. They call our team at UCLA and they're like, all right, roger that. We'll be waiting for them up here. And yeah, they've had a few success stories. There's one patient now that, we're on the verge of healing, but they just need more support, and getting those serial debridements. That's a testament to the team. It speaks to our collaborative efforts between our wound care center and them. And also, it also speaks to like the patients, I feel too. They want to heal too. Like, we've seen all our patients that live their lives with this. Now, couple that with the fact that you no longer have a home. Couple that with the stress of not knowing where you're going to sleep or stay. And to see that is just like, it's really like impactful. You know what I mean? Makes you want to do more, And I've had a blast. I think if I would have known about this stuff before.
I know, me and Hawk always joke like, all right, that's it. We're gonna do this full time, because it's something else. It really is.
Getting to interact with patients. And like, another story I had was like, at our wound care centers, I dropped a can of beans on my foot now, or my leg, and it scraped it. Now I have this ulcer. I stubbed my toe. I stepped on a rock, right? Street team got bit by a pit bull. And
Yeah, I remember that patient.
I was hit in the face with a machete. And you're like, what? Like, okay. I got bit by like all kinds of bugs and now I have all these things, you know? And then it's the psychosocial aspect or that kind of thing. We're just trying to navigate while you're doing wound care. You know what I mean? Like, it's what I mean by that is like, you know, like, oh, it's healed, you know, and you know, the aliens helped me heal it. And you're just like, well, okay, all right, how are we going to figure this one out? Like, how are we going to explain to them in a way where we don't, you know, we know in wound care compliance is everything. We can put thousands of dollars worth of dressings and they can come in, but if they're non-compliant with what we do, so trying to navigate that and trying to have these conversations, again, all these things that are just makes that whole level of wound care super challenging, yet ultimately so rewarding when things go our way. And when I reached out to the team just recently, I was just like, hey, let me just say first off and foremost, my bad for thinking that full wound closure wasn't going to be a thing for us. Through your dedication, through the education, through our collaboration, and just how effective your team has been, I'm going to remodify everything that I'm talking about from here on out and help you guys get to that wound closure. Because again, remember initially we were just talking about stabilize the wound. Now it's like, all right, what else do you guys need? What else can we do? Now, obviously, wound vacs and all those kinds of things aren't something we can do. However, if we can start talking about collagens, if we can start talking about, you know, different treatment modalities that will get us closer and closer to healing, the team there has clearly demonstrated their ability and their capacity to do such things. They're just, it's phenomenal. It's amazing to work with them. And they're just super cool. They're all super cool. Nobody, they don't have any egos there. They're all just like, yo, let's get it done. And that's awesome. You know what I mean?
It's really amazing what you guys are doing, for sure. I just go back to, you know, all of a sudden we're getting wound closure and how amazing that is. And yes, it is through doing amazing and great wound care on the streets. But you said something, Hawkeye, that really resonated with me. They're building trust with these patients. They're giving them hope. And a lot of these patients that find themselves, you know, without a home, if you go back to their early childhood, you can see a strong correlation between high ACE scores, which if you don't know what that is, to our listeners, it's adverse childhood experiences. And it's a set of 10 questions. If you answer yes to more than 4, you are like high risk of being without a home, drug addiction, mental illness, health conditions like diabetes, hypertension, things like that, which we all know correlates to a high risk of adapting a wound. But the thing that a lot of people don't know about ACE scores and having a high ACE score is that entire score can be eradicated by one loving person. So a lot of these nurses, like yourself, Hawkeye, and Christina, when you're going after these patients, not only are you, you know, helping their wound, you're actually helping them recover from whatever past trauma they've experienced. And I think we could actually look and see like, oh, is this playing into these wound closures? The fact that, one, they're finally getting the care they deserve, but they're also getting that support and like, hey, I see you. I see you where you're at and I'm not judging you. So I just think like the whole thing is really beautiful. And the fact that we're able to shift, like just manage these wounds to let's heal these wounds is, you know, a big testament to your guys' mission to wanting to help these patients. Because like you said, Hawk, you have to want to be out there. You can't just be like one day, oh, I'm going to go do street care. No. Like you want to be out there. So
this is why I love Kallie. She always brings like a different viewpoint. And I love that you just shared that, because it was one thing like we always knew, and more so after nursing school when I got more into this, like sometimes our patients in clinic, you know, there is a mental health factor or if they've had it for a really long time. Like I remember we had a patient that never wanted to heal. It just because they didn't want to stop coming into clinic. Remember, Hawk, like they were lonely. And so they didn't want to not come in, right? And so you're always dealing with that. But when I learned about and going out into street care, it's tenfold. And it was initially. And we had a patient that they showed us, and he straight up, it was a really bad wound. He had left on that hospital bracelet, and it just, a wound, it like engulfed the bracelet. Like, it was a whole thing on his arm, but he didn't want any like help. Like, he's like, no, I'm okay, I'm good. And it's that, right? Like, just like you said, it's like this, I'm okay with this, I don't trust you guys. And slowly, week by week, they like worked on him, and slowly he allowed us to help him. And it's, yeah, it's not just like going out and being a great provider, it's being patient and chipping away at that week by week. And some of these individuals don't like men, right? And so they have a good mixture and like of different people, and it's always the same people. If they know they're going to go see John Doe, they know John Doe only likes Hawkeye. Hawkeye's going to make sure he's on that team. And I think that's just so important. Like, we're not just like, no, they'll get over it, we need to do what we need to do. Like, it's very thoughtful in everything that they do. And I love, Hawkeye brought this up earlier, where they're like, hey man, like, we got the wound care team, where you at? But it's also like, oh, I know John Doe only likes to be seen on Tuesdays, so like, we're going to plan around our day around Tuesday so that we can see him. And we know he likes to be by Whole Foods on this day, but if he's at the park, it's not a good day. It's not a good day when he's at the park. Like, they know these people. It's wild, and they all remember it. And it was just really cool to see and to experience, like, the level of care, not just from a clinical perspective, but like a individual perspective. And just like what you said, like, they truly love these patients. They're not just people.
I think, one thing that like we were able to share with them, and when I say them, the street care team, was, nurses often will get this kind of like task mentality, right? Will often be like, okay, what do I need to do to make this heal, right? Wound care, I've learned through the years, I've learned through you, I've learned through experiences, is that, a lot of it is compliance. I mentioned this before, where it's like patients will come in and we'll work with them once a week. The other 6 days, they're left to their own devices. They're left to their own ideas. They're left to whatever it is that makes their lives complicated. When I have new nurses, I explain to them, sometimes you'll get a patient who comes in. They've had this venous stasis ulcer, this diabetic foot ulcer for years. If you were to ever go to their house, you would see that their entire home setup is built around that wound. You could actually follow a path where the drainage would be on the floor. And because they know that all I have to do is walk over here, get this, I have to go over here to get this, I have to go over there, this, and then I sit on my chair or go to my room, whatever. And when these patients come into the wound care center, we flip that whole thing upside down. We debride them, we give them a dressing. It may be uncomfortable. It may be, and again, it factors into the trust. So as wound care nurses, we have to make sure we establish that trust. I often teach nurses too, and I taught this to the team, is, we need their compliance. So however we have to get their compliance, build that trust. And when they start to see the improvements, despite the pain, despite the inconvenience that we are now causing them, that's how we get that buy-in. And that's how they know we're not full of shit, right? That's how they know that we're doing actually things that we want to help them. So a perfect example was like when we were going over compression wraps. We applied compression wraps, how we apply compression wraps, right? They did that. They went out there and they did that. But guess what? Too tight, uncomfortable for the patient. Patients are now cutting them down, causing more wounds because they're not using real scissors. They're using, blades and whatnot. And so we had to kind of like regroup with the team and be like, listen, some compression is always better than no compression. So how can we build trust, gain that confidence, get that compliance from them? Well, this is how you do it. You apply compression that's not too tight. You make sure, does this feel good? Does this feel good? Explain to them, educate them. Like, if it feels tight throughout the course of the day, that means your leg is swelling. Kick your feet up, relax, do something, get off your feet. And then what they were reporting to me is that, like, as they slowly, the next time they would see the patient, the compression's still on. Hey, guess what, John Doe, I'm going to tighten it up just a little bit more till we get to that therapeutic level. And again, speaking to the dedication, the effort, the time, I'm sure some people would be like, listen, this is how tight it's got to be. Sorry, you got to live with it, right? but you're never going to get compliance. You're never going to build that kind of trust. You're never going to get that kind of like on that level with them unless you slowly, incrementally do it. And again, speaks to the dedication of that team, speaks to the heart and energy of that team, willing to work with them, no matter how long it takes to get these things done. And that's, again, that's pretty cool. Try that. So yeah, these guys are amazing. The patients too. They all come with stories, man. You know, when you get to work with them and interact with them, you start to learn a lot about them, and you know, and we get that at our wound centers, but you know, even more so here. And then the individuals that are really trying to like, you know, do something right, you know, you get behind them 100%. And it's not just about their wound, but after a while, you're just like, yo, how's he doing? Oh, cool, he got a place. That's awesome. Can we go, you know, they're like, can we go visit him at his place so make sure he gets the wound care? Do we need to transition him over where we can start getting him to the wound care center? You know, it just becomes this whole thing and you get really involved. And I think that's what's amazing.
Which I think, you know, wanting to become involved, I'm assuming a lot of people are going to feel inspired after this, Hawkeye, especially hearing your story and just the impact not only you guys have on that population, but the impact they have on you guys. Any advice to a clinician that's, you know, wanting to get involved in their local street care team?
Just got to go out there. You just got to go out there and do it. I think if someone was very inclined to do that, to be, you know, to help that, is you just got to go find the department and just be like, hey, I have wound care experience. I'm here to help. You know what I mean? And then as soon as you take that first step, you just have to open yourself to understanding all the dynamics involved with it, right? And we talked about this earlier. It's understanding that like, hey, these patients don't have a home. These patients will have to worry about food. They have to worry about shelter. They have to do that. Being able to kind of accept that and make that, you know, and modify the way you will treat these patients effectively. You know what I mean? Sometimes wound care nurses and nurses in general, they get very, like I mentioned earlier, task oriented. They get very like regimented. It's got to be this way or it's never going to work. You have to be able to adapt and modify and be flexible and agile in that sense to really make that kind of thing. And if you have the heart and the dedication to do it, it's rewarding. Now, is it going to be like as rewarding and as, you know, instant, or you're going to get that gratification like instantly? No, this is a marathon. It's an ultra marathon. This is a triathlon, for crying out loud. You know what I mean? And you just got to chip away. But when it finally starts, when you start to see the benefits, when you start to see the outcomes that you're looking for, there's nothing more rewarding, man. At least in my assessment. But what do I know?
I would also say, like, if you're listening and you don't like you're new to wound care, or maybe you've been a nurse for a couple years bedside and you're interested in wound care or just street care in general, like, don't be discouraged. Reach out to those groups if your hospital system has something like this, because I think even your experience will bring value to the team, right? And you'll learn and be more comfortable in, let's say, wound care specifically. But as Hawkeye mentioned, this is a holistic approach. So if you can benefit in another way, or doing, you know, a head to toe, or assessing their mental health, if you're in you know, psych, like whatever it is, I think good clinicians, that's what we need, right? Good clinicians who are passionate about helping is what we need. So don't be disheartened if you're like, oh, I only have a year experience. Who cares? You may have something that benefits the team. Like, I would rather you get out of your comfort zone and ask and be a part of it and do a ride along. Like, I can't speak for other centers, but I think UCLA, like, anytime we're like, someone's interested, can they do a ride along? They're like, let's go. We want to show you, because they want to show people this side of care. And you can really see that, and if that's something that would work for you. But I just feel like there's this group of clinicians out there that's what your heart speaks to. And I would say do it, because I think it's so rewarding and it's so cool to do. Yeah, I really enjoyed it, and if I could do it every day I would. But it just, I think anyone who has that passion, like, just do it. Just ask, seek it out.
Yeah, 100% seek it out. Seek it out and get after it. That's the only thing I would say. Because if you just, you know, and then the other thing to that too is like if you go out there and you realize, oh no, it's not for me, it's all good. You know what I mean? It's all good, because if you don't know, how are you going to know if you never try, right? Some individuals that are like, oh, I want to get down, I want to, be a part of that. They get out there and then they see the kind of environments that you work in and stuff like that, and you're just like, ooh, this is rough.
You're like, not for me.
Yeah.
Well, I think
Whereas,
that's a good point, Hawkeye, because even when I was a teacher, you could see that within the teacher community of, teachers want to help the kids from high risk environments. They want to be there with, the Title I schools, and then they go and teach at a Title I school, and they're like, never mind.
yeah.
Let me get back to the other school where I have parents that are supporting kids that are coming in with full bellies, clean clothes, right? I can't do that. I love them. I love the other students, everything like that. But, and I think it's like the same, right? Some clinicians, their heart's in it, but maybe they have too much, feel too much when they're out there, and it becomes overwhelming for them.
Yeah.
Just like
Yeah.
in a teacherscape, right? Some of those students aren't for every teacher, just like those patients aren't for every nurse, even if your heart's in the right place. So I think that's, important for everyone to kind of understand, like, yeah, don't feel bad if you get out there and you're just like, oh, not for me. Like, I can support from the sidelines all I can, but not for me. So,
Yeah. And again, just being involved with that, right? If that is something you want to do, maybe, you are a wound care nurse and you have some experience, and, the street team needs that. Maybe you can provide that education for them. Maybe you can think, but you just got to do it, to know if it's going to be right for you or not. And if it's not, then hey, it's not. You know what I'm saying? But I will say that, for me personally, one experience, my very first ride along, we went to a camp, which was in an underpass. And I was just like, even me, and, I was like, oh, this is dodgy. You know what I mean? There's one way in and one way out. And I was just like, we're going to go deep into this camp. You know what I mean? So yeah, it's an experience. And if it's for you, it's for you.
My first ride along, I was a little scared also. I mean, I'm 5 foot nothing. So and I luckily I got Hawk, and they had security, but it was scary. Especially because sometimes I feel like, especially with mental health, these individuals may choose you as like that's who they want to connect with, that's who they want to engage with, and this person did, and he it was a new environment for me, and so I was getting a little close, and I was like, oh my god, like you never know what happens, and this could happen anywhere. I'm not saying because of a street care, like we've had dodgy patients in clinic as well that do some things, but it was an adjustment, definitely out of my comfort zone. But then, trusting in my skill, trusting in my team, like they got me. I knew if something happened, like I'd be okay. But it can be scary. So I don't want to take that lightly either. If that's something you're nervous about, it can be. But again, find out about the team, find out what resources and who they're bringing out. Like they will never send out a crew without security, which I think is really great. And you never go alone, right? Like you're at least in a threes at the very least. Yeah, so it's really nice. It's really nice, the type of support. But I wanted to kind of lean into on the opposite side. Like if you're a hospital or you're a part of a clinic that you guys have been wanting to do street care, because I know they've have like street care in Orange County that we've talked to a lot of groups. And I will say the reason why I'm impressed the most with UCLA's homeless healthcare initiative is they really took the full approach, and it's really quite impressive. Like Hawkeye said, you can go in and we saw a patient that said, I need more meds, but I just can't get to the ED, or I can't get to here. And they're like, we can do it right here. They have the Ep6 system on the van. They have the pharmacy component because they have physicians on there, and they can dispense right away. So it's not this disengagement as well. Like, here's your prescription. Now they have to figure out where to get it. No, they can dispense it. Like, it's like a one-stop right there. They get everything that they need. And so I think if you're looking to expand this type of clinic and care, like, love to talk to you guys about, like, reach out. We would love to kind of share the experience that we've learned, because we've learned a lot from A to B, but also how can you make wound care more impactful, what type of engagement, what vendors you can possibly talk to and partner with, just from A to Z. Like, really, the information that you need, like reach out. This is not something we're gatekeeping at all. Like we feel every community should have this, especially with the growing numbers of individuals being impacted by homelessness. Like we know it's growing. And so if there's an opportunity where we can help support, like please reach out. We'd love to share with you what we've learned. Yeah, what I wanted people to get out of this episode is if it's something that you feel like your community needs, it's possible. Two, if you as a clinician want to get involved, it's possible. There are ways to make this successful because one thing, I don't know if you were involved, Hawkeye. We had talked to a group similar, Kallie, that did it in Orange County. Very different and very like, they need more help. They were literally just going out with like a wagon and walking around and like just, yes, that's great. But it was, I think harder to sustain.
I think not just harder to sustain, but like you're not, yes, you are helping these people. You are having, all the good intentions, but also like, what are you doing more than just like, here's something, right?
No, and that's what I really loved about UCLA's approach is it's not just like, here's a Band-Aid and see you next time, right? It's like they're following through, which is why, again, healing patients, that's freaking huge. Like, I just, that's so incredible. And I'm so excited to do case studies and like highlight like beginning to end, like what we were able to do.
I mean, we say this every time. This is our favorite episode, right? This one for me ranks right up with Suzanne talking about HS.
No, I love our stories like this because I don't know. I love it when it's different than our not that what we do is mundane, but it can be, right? And I just think being able to view how what we do on our day to day can be so impactful outside of the four walls of our clinic, I think that's so special. And like street care is so near and dear to my heart. Like, I love that. And like doing that in other countries and like Thailand and the Philippines, totally different. Obviously, we don't have that same resource, but that's the level of care that I love is impacting the people that need it the most, our vulnerable populations. And that number is just growing, right? Like it's, I don't know, if one person out of this podcast takes this back and like to their maybe rural hospital or whatever hospital and is like, hey, I heard that WCA is working with UCLA and they're doing this great thing. And like, they were talking about A, B, and C, and we never even thought about that. Like, is this something we can do? Like, then it's worth it. Tenfold. Like, it just, yeah.
I couldn't agree more. And I think like, yes, I'm not from a clinical background, but I mean, I was a teacher for a long time in my past life with these students that are very much in the realm of being without a home as an adult, right? They come from extremely, poverty. They're hungry. They don't have heat in the winter. And I'm in here in Utah, listeners, so our winters are brutal. Their parents are strung out on drugs. They're getting into drugs by the time they're in high school, right? And so it's one of those things that, I mentioned with Hawkeye, these ACE scores, and I think more clinicians need to be aware of it. As teachers, when we work with these, and I never say high-risk students, it's always students from high-risk environments. And I think that we can say the same with patients. They're not high-risk patients. They're patients from high-risk environments. And I say that because it's not their fault where they're at, right? Things happen to them in their life to put them there. Could they have made better decisions at one point? Absolutely. But when it comes to these ACE scores, you have to understand that the brain is rewired every time you experience something traumatic. And it could be as something as having parents that yell in the household. It could be any type of abuse. It could be any type of drug or alcohol addiction, whether it's you experiencing it or a member of your household. And each one of these factors really plays into the decisions of why you make it. And so I think it's important for not just teachers to be trained on this, but also clinicians, because like I know, Christina, with your experience of doing a lot of, this charity work and volunteering your expertise and things like that, you have a deep understanding of the whole human, not just the patient you're treating right now. And I think that's what's so beautiful about the UCLA team is every single person in that, on that team also sees the whole human. And I think if we can help maybe have more people understand childhood experiences, trauma, things like that, even if they're not going out and working on the street, they might become better to help the patients that are non-compliant, right? Why are these patients non-compliant? They don't trust you. So how can you, get them to trust you? How can you build that relationship with them? Maybe they're going, like Hawkeye mentioned, in this interview, which you listeners will hear, is their home revolves around these wounds sometimes. So how can we help them really see them as a human and that they deserve more? And I think that's why, like, when you brought up, hey, can you help with education on the street too? I'm like, yes, 100%. I might not be able to go out there on the street and, provide the care, but what I can do is on the back end, make sure that the teams have everything they can to, care for these patients.
I couldn't agree more. Like, I love the fact that, and we like preach it all the time, but it's just because you're not doing that actual patient care doesn't mean you can't be impactful. And I think you and your team and a lot of people in our company show that. It's just because, yes, I get to see the patients and I get to see the results right then and there, but everyone that's supporting us is doing it as well. And I think that's why having that beautiful team effort and being able to, like, I can come to you and I'm like, Kallie, I love what you did, but like, we got to tweak it, right? Like, we got to tweak it a little bit because this doesn't count for our street team. They're not going to encounter this. We need to change it. And you guys are always like, yeah, like whatever we need to do, because it's not a one size fits all. We're always adjusting. We're always learning. And I love that we were able to adjust and modify and adjust again, because now things are changing again with this team and the care that they're providing. So I just think that's so cool.
It's been like, because when we first developed education, bare bones, literally what makes a wound, why does it become chronic? Here's some common wound types that you'll see out on the street. Here's some basic wound hygiene, and then some dressings, right? But from that very first...
But also, do you remember we're like, we're going to print out flyers. We're going to do pamphlets and da-da-da-da. And then after I was like, no, that's not going to work, Kallie. They hate paper. They don't want anything.
They don't want anything. And I think that was even, and that was, I was so grateful for the vendors that did support us on that, because, they had all these other grand ideas too. And we were able to come back to them like, okay, scratch all that. This is not what's going to happen. But anyways, what I was saying is it was really neat to see that the first step we put together on the education to where it's evolved to now. Now we're actually getting into that deeper wound care education, things that we give out to our own clinics, right? To our own wound care nurses, because of their, how much they have evolved with their knowledge and just, that hunger to learn more. Like, okay, we got one wound closed, let's close them all. And I think that drive is, really what makes that team so special.
Yeah, no, I agree. But yeah, if you guys really enjoyed this episode and have questions, or you want to be a part of something like this, or your hospital started something like this and it's not quite working, whatever it is, at whatever capacity, reach out. We're going to put the link below. Reach out and we would love to get these resources to you. Again, we're not here to gatekeep. We want to expand this program and we want more people to do it. And if that is just you guys have questions or need more resources, reach out. But yeah, we hope you guys enjoy this episode, and we'll catch you in the next one. Bye.
Thank you for listening to the Unwrapped Podcast. We hope that you found the information and insights provided to be helpful in your wound care journey. If you have any questions you'd like to be answered on the podcast, we invite you to connect with us on Instagram, LinkedIn, and YouTube. And place your question or comment under the Unwrapped Podcast post. We look forward to bringing you more wound care insights. Thank you for listening.
With MyLuvo, everything is right there. I can see exactly who's coming in, how our patients are doing, and where we stand. No back and forth, no guessing. Documentation reviews, denial prevention tools, all built in. Training updates, staff reminders, wound care insights, done for you. No more emails, no more whiteboards. It's all in one place. Everything we need to track our performance and plan ahead. Patient volume, visits, revenue, collections, and admissions. Make wound care easy for your center. Start with MyLuvo.